Hi, my name is Taylor Toch, and I'm doing my mastery checkoff. I'm going to doing my first check by comparing the MAR to my meds. MAR, meds, was given to me. So I have Marcus Perez as a 58-year-old male admitted yesterday for a left knee arthroplasty related to osteoarthritis. He reports his pain is now 4 out of 10. He has been experiencing urinary retention since surgery and has new orders to start a foley catheter. It is now 9 a.m. The healthcare provider's orders are to insert a foley catheter, give heparin 5,000 units sub-Q every 24 hours, morphine 2 milligrams intramuscular every 4 hours as needed for pain. So looking at the MAR, it has heparin 5,000 units sub-Q every 24 hours. Last given him yesterday at 8:45 in the morning. He has morphine 2 milligrams intramuscular every 4 hours as needed for pain. That looks like it was given to him today at 7:15, and since it hasn't been 4 hours, I'm not going to give that to him because it is 9 a.m. and it was last given to him at 7:15 in the morning, and he's also at a 4 out of 10 pain. So I'm not going to give him the morphine, but I am going to give him the heparin, 5,000 units. And I just want to double check everything. He has no known drug allergies. Yes, so no known drug allergies, and we're giving heparin. So now I'm going to go ahead and prepare the meds. So I'm going to match the med label to the MAR. Okay, and I have all my supplies. Also, I am giving him a foley catheter, so I went ahead and grabbed that already. But I have alcohol pads, a 3 milliliter 25 gauge needle, syringe with needle and syringe, and it's 5/8 in length. Blunt tip to draw it up, tape, and all my supplies. Sorry. Okay, so I'm gonna go ahead and label the syringe. And I'm labeling it heparin 1 ml. Okay, so here's my bottle. Just gonna get rid of that. Okay, so I have heparin, 5,000 units per ml. The MAR says he needs 5,000 units sub-Q every 24 hours. So that's 1 ml. I'm going to give him. Right patient, Marcus Perez, dose 1 ml every 24 hours. So I'm going to give it to him today once. And I'm going to give it sub-Q, and I'm just going to give it right here behind his arm, the upper, like just behind right there. And it is a blood thinning medication, and it's going to prevent blood clots during surgery and after surgery. So that's why we are going to give it to him. I'm going to consider, signs of bleeding, abnormal bruising, stuff like that. This might, have my patient experience, like some side effects are hair loss, anemia, and maybe a rash or a fever. And the expiration date looks good, so we're all set there. So I'm going to go ahead and draw up the meds. We'll start with an alcohol pad. And I'm going to clean it from inner to outer for 30 seconds. Okay, throw that away. While I allow that to dry, I'm just going to go ahead and draw up using a blunt tip needle. Oh, drive in a little bit, get 1 ml right there. Alrighty, that has dried, so I'm going to go ahead and air to air over and draw out 1 ml of heparin. And I'm going to flick out any air bubbles that are in there. Okay, that looks good. Okay, I'm just going to go ahead and recap that blunt tip. Get this out. There we go. And to get rid of that. Put this here. Go. Label. I'm also going to keep it out of the way so I can see. But there we go. So heparin, 1 ml. Heparin, 5,000 units on the MAR. Okay. So that's ready to go. Okay, so I have gathered, now I'm ready to enter the room. So, move that out of the way. I have double checked my doctor's orders. I have gathered my supplies. And I am going to enter the room. Knock, knock, knock. Closed door for privacy. Hand hygiene. Hi, Mr. Perez. My name is Taylor. I'm an ACC nursing student. I'm going to be giving you your medication today, and I'm going to be inserting a foley cath for you since you are going into surgery. Can you give me your name and date of birth, please? Okay, great. I'm just going to double check that MR number. You don't know it by chance, do you? Okay, great. 1, 2, 3. Gotcha. Okay, I'm going to lower the bed rails and raise the bed to a working position. Alrighty, Mr. Perez, I have your heparin. This is a blood thinning medication. It's to help you help prevent blood clots while you're in surgery and when you come out of surgery. And you don't have any allergies, do you? I meant to ask that earlier, but okay. Sweet. This drug, heparin, it might make you, you might get a fever from it, might experience some hair loss, maybe a rash, but again, I'll be in and out to check on you. So, yeah, I'm going to start by cleaning your arm, because we are giving it sub-Q, so I'm going to give it right back here on your arm. I'm going to start by cleaning your site from inner to outer for 30 seconds. Okay. Allow that to dry, no fanning it. is dry, so I'm going to get rid of the cap. I'm going to Z-track and at a 90-degree angle. Okay, and activating that safety and disposing this into the sharps. Okay, taking off my gloves, applying the Band-Aid, and I'm going to document the site that I gave it to you at, which was behind like your arm, kind of right there, and the time. Alrighty. So now I'm going to insert your Foley catheter. I'm going to make sure that you're in a good dorsal recumbent position with your knees bent. Let's get that out of the way. Okay, and I'm going to lay a pad down, and pericare has been performed. And I'm going to wash my hands after giving you your meds, of course. But I'm going to just go ahead and set up my sterile field here. Start by making a trash can. This bag. Okay, right there. And by picking up the corners, the edges, not touching anything. I'm going to open this. Not touching anything. I'm going to make a drape. Just like that. Okay. Gloves. Turn it over here. That. So I'm going to start with my dominant hand by pinching the cuff and wiggling my hand in. Okay, now scooping under this cuff, going to put my hand in just like that. Okay, now get this out of the way. Okay, now that I have sterile gloves on, I'm going to push this drape down and just create a better working area for me. Okay. Alrighty. Now I'm going to attach the pre-filled water right here onto the catheter. And I'm going to get rid of this blue thing, trash. Okay. Alrighty. So I'm going to start by lay this down right there. I'm going to clean now. I'm going to grasp there. Going to hold the penis slightly up with some tension. Just hold this up at a 90-degree angle. And I'm going to clean. There we go. Breaking the sterile field. I'm going to take one cotton swab and go down to the base. Robot arms clean and throw that away. And I'm going to repeat that 2 more times, starting from the top all the way down to the bottom. Clean. Throw that away. Top. All the way down to the bottom, one more time, not crossing the sterile field, and throwing that away. Now I'm going to insert 5 mLs of lube, making sure to hold that at a 90-degree angle, holding it about 1 inch from the top. I'm going to insert the catheter. Alrighty, take a big deep breath for me. Okay. And I'm just going to hold that there. And I'm going to inflate the balloon in there with 10 milliliters of water. Which I might have to come above. Okay, so once that is done, pause that and I feel a little resistance. I'm going to lay that back down. Okay, and remove my gloves. Go. And I'm going to tape this. Well, first I'm just going to hang this right here, not on the bed frame, but on the bed below the bladder. I'm going to tape this here for, just so it doesn't move on your leg. There we go. Clean all that up for you. Okay. Awesome. So now I am done with that, sir. I'm going to cover you back up. Perform hand hygiene. How do you feel after that? Are you in any pain at all? Are you comfortable in your position? If you have to go to the bathroom, you're all set up, you're ready to go. You're not in any pain. Do you need anything? Do you have your cell phone? And here's your call light. I'm going to put it in your hand. I want you to call me. Press that button if you need anything at all. I'm going to lower the bed, raise the bed rails, and we're done. Oh, and I'm going to foam out, exit, and I'm going to document the size of the catheter, the color and clarity of the urine, and then I'm going to document his response as well.